Someone asked me, what are some of the most memorable patients you've seen over the last almost 40 years in practice? And this one definitely comes to mind. A 10-year-old boy whose abdominal pain and headaches were so severe, he missed an entire year of school. So I'll tell you how I discovered what was wrong and how he got better. My name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of The Free Diet. And if you find this information helpful, please like and subscribe so more people can see this video. Most of our new patients come in with some type of gut symptoms, and this patient was certainly one of them. I remember it so vividly. His mother came barging in the front door of our clinic and said, "Is there anything you can do to help my son? We just got back from the psychiatrist upstairs. He's putting him on more medication and he's already on 10 different drugs, which aren't even helping. So I don't know what to do." And she threw this bag of pills on the counter. And I'm like, oh my gosh, she's serious. She said, "They think it's all in his head, but I know it's not. I know there's something wrong with him. He's been to all these doctors and they can't figure it out." So we set him up for an evaluation, and he had been having severe abdominal pain and headaches. It was so bad he couldn't go to school anymore. He missed an entire year of classes. He'd been to the pediatrician, many specialists. They couldn't find anything wrong with him. He was on 4 drugs for abdominal pain: H2 blocker, PPI, anticholinergic, anti-nausea medication, an antihistamine, a beta blocker, anti-seizure medication, and he was on an antidepressant and a drug for anxiety. And none of this was helping. At night, she said he would moan and scream in pain, and his brothers and sisters would start beating on him to be quiet because they couldn't sleep. He was so loud. He also had a scoliosis. So I started treating him for that. And one of the tests I did was a comprehensive stool analysis, which came back positive for hookworm. Now, there are many parasites that can get better with natural treatments. Hookworm, however, often needs drugs to effectively get rid of it. So I told her to bring the results to his pediatrician, and she wouldn't prescribe him medication for the hookworm. So the mom asked me to call the doctor, which I did. She's like, "No, I don't know what this test is. This is a PCR test. That doesn't mean anything." Now, a PCR test checks for DNA, and it wasn't very popular back then. A couple of years later, it became much more widely used for gut pathogens for stool testing. But at that time, she had never heard of it. Now, this is the same PCR test that they used to shut down the entire world during 2020 when we all had to get those tests, up the nose PCR tests for a certain virus. So yeah, that PCR test. In any case, it picked up that he had this hookworm and she wouldn't give him drugs for it. One doctor he went to was an infectious disease specialist. He looked at the stool test results and said, "No, there's no way he has hookworm. You can only get that if you're from a third world country, not in the United States. That's ridiculous." And wouldn't treat him for it. The mom was telling me this, and I remember bringing up on the computer right in front of her, hookworm, South Florida. And this story comes up on how the prior year there was an outbreak of hookworm on Miami Beach from stray cats that were using the beach as like a litter box. And 15 people got hookworm from walking barefoot in the sand. And it's the same thing with this patient. He had pets at home, walked barefoot all the time, outside, inside. So it's not surprising that that happened. And there's millions of cases of hookworm around the world. Just because we get to the United States border, it just doesn't say no hookworm can live here. I mean, that's ridiculous. In the meanwhile, I put him on an anti-inflammatory diet and some supplements to help with gut support. Eventually, his mom was able to get a doctor to prescribe 2 rounds of Pinax and then a 3-day course of mebendazole, and his symptoms became worse. Headaches, stomach pain. He was groaning. I mean, it was so bad. He was screaming in pain. The neighbors called the police because they thought he was getting abused. The police came over. I get a call that week from Department of Children and Family Services. They thought the kid was being abused. So I had to explain the situation. I mean, it was crazy. I'm like, "No, he has hookworm. This is what's going on." They didn't take the kid away. Finally, the mom found a pediatric gastroenterologist that agreed that yes, he has a parasite, agreed with me on that, prescribed him a 30-day treatment of albendazole, still had him on the diet and gut support nutrients. So soon after that, he came in for a visit and I said, so how are you feeling today? And he's like, yeah, good. I was like, oh, okay. So how's your stomach feeling? Yeah, good. I'm like, how about your head? Yeah, it feels fine. And his mom's like, what do you mean? Well, why didn't you tell me this? And he's like, well, you didn't ask. So I said, when did you start feeling better? He said, well, actually, I came to your office yesterday and it was so bad, the nausea, I started throwing up outside and I couldn't even come in. So we went home and then I felt better last night and today I don't have any pain. Like, oh, okay, well, that's good. And then this went on for at least a couple more weeks where he said he felt fine, no headaches, no stomach pain, nothing. At that point, was off all his medication. And we did another stool test. It came back negative for hookworm. He was able to go back to school and start to get his life back. So what can you learn from this? Well, number one, be careful where you're walking barefoot because that's how you get hookworm. And I'm happy to say they didn't take her son away and commit him to a psych hospital. We were able to find out what was wrong and get him the proper treatment. So if you are suffering from chronic gut or other health condition and you aren't getting better, it's important to get the proper testing first, because if you find out the root causes and are provided the right solutions, I believe almost anyone can get better. Thanks for joining me today. I'll put a video that goes into the free diet that I use to help people with chronic gut and other health conditions here. The free diet phase 1 food chart below that we'd be happy to send you. Feel free to like and subscribe so more people can see this video, and I'll see you next time.